it also opens up some automation potentials. So, and the really exciting things we're thinking about are, could I, in the workflow for the user, I could actually provide the mechanism. They showed this actually in the demo, where you can actually get. You could like do a query for all of the pediatricians in this zip code that support 360X, which is a special way of doing closed loop referrals. Okay. So I could do well, who can really do these newfangled closed loop referrals that a very small percentage of the market can do, and where are they? And show them to me on the map. So that they were able to demonstrate that. It's a very, very interesting idea.
As one of the entities in the Shiny, direct messaging is a core service for us. And so it's really critical that we have a stable vendor and that it's easy to implement, easy to maintain. And for us, moving to Secure Exchange Solutions, or SES, reduced our administrative burden in maintaining a HISP. It made it a lot easier for us to wrap deploying that service into our operational procedures. And it also helped us hook in direct messaging where appropriate to our interoperability solution to help the flow of information.
COVID taught us a lot, right? What the data we didn't have, the data that we needed, from who we needed it from, and the infrastructure to put it on. And this is really, how do we get it right? How do we make the investments in the right area? How do we collaborate and cooperate and partner and innovate together to make sure that we have a digital health strategy that works for the entire country?
We want to expand more services, provide service provision much easier, simplify it way outside the medical or the clinical setting, and this is just all part of that process and part of that evolution. Give people a handheld app where they can manage their demographics, where they can manage their consent, all part of that process. Simplify identity proofing. Let's validate that John is who he says he is.
This year we have focused largely on the completeness, improving really the completeness of race, ethnicity, and language data in our system. And that way we can serve that up, again, to stakeholders on our network to help them identify disparities and then implement interventions to address those.
Pulse, the Patient Unified Lookup System for Emergencies, it is a disaster response health IT tool that helps disaster response volunteers in alternate care sites, such as a church or a football stadium, be able to access electronic health information from a smartphone or a laptop or something of that manner, basically for environments where traditionally these environments don't have access to information, and we're bringing the information to them.